Well, hello everyone. Welcome to our first session of PramaTalk here at the Prama Institute and Wellness Center. And today we have with us our director of the Prama Wellness Center, Ramesh Bionis, and he's going to be talking about foods and for the heart. What is the best diet to improve and strengthen our heart? So, uh, hello, Ramesh. How you doing?
I'm doing fine, thank you. Yeah,
Okay,
nice to be here.
great. So, we have a few questions for you, and
Okay.
we'll start out with our first one is exactly we know that heart disease is one of the most common diseases and causes of death in the world today. What is the main cause of heart disease in our culture?
Yeah, that's a very good question and an important one. As many of our viewers will know, heart disease, cancer, and diabetes are the three leading causes of death today in America. And I would say that the main reason for that is the change in our diet over the last 30, 40 years, which means that we have gone from a culture in which, yes, we were eating meat and fish and dairy products and so on, but predominantly the combination of an increase in dairy, meat, and sugar, and also refined foods. Those types of foods have increased dramatically in the last 30 to 40 years. So I would say that that's one of the main reasons. At the same time, our lifestyle has become more sedentary as well. So, we drive, we sit in front of our computers, and at the same time, many people are snacking while driving and eating between meals, and because food is everywhere nowadays. One of the most dramatic research pieces that supports this idea is the China study that I'm sure some of you have heard of, which was conducted by Colin T. Campbell and his research team in China over a 15-year period, where they basically found that as the Chinese in these urban areas changed their diet from predominantly vegetarian to a more meat-based diet, heart disease, diabetes, and cancer went up 70%. So that's a tremendous increase, and so this has been documented, and at the same time, of course, in our culture, in America, in the Western Europe, you see pretty much the same thing. Before I end that with answering that question, I want to mention not another study that was done in Norway during the Second World War. I'm from Norway, and in Norway at the time, people didn't have much meat and fish, so they were forced to eat a much more plant-based diet. And what you saw was a dramatic decrease in heart disease. So I would say that the main reason is the increase in animal-based protein and an increase in uh, foods such as sugar and other refined foods, refined flours, refined um, uh, pa- you know pastry, cakes, all of these types of foods. There's been a tremendous increase in that, and so those two are the main causes.
Okay, well, we know that a lot of people suffer from heart disease. They've developed a lot of medications for them, for it to uh, dilute make the blood less thick, and it just to handle their heart problems. And besides these medications, also people, if it gets a little bit more severe, sometimes they put stents in to keep the arteries open when
Yeah.
they're suffering from arterial sclerosis. Are there other ways to deal with heart problems like this? the clogging of the arteries and etc.
Yeah, exactly. So yeah, another good question. So yes, so as we have seen the increase in heart disease over the years and becoming a leading cause of death, we have of course seen an increase in the use of medication and the use of stents, open heart surgery, and so on. So yes, these medications certainly they can be helpful, and certainly I'm not against the use of medication uh, and having an operation if you are dying literally in the hospital. These things are necessary, of course. So this is one of the great benefits of modern medicine is that we have these ways of doing it. But why not try to prevent heart disease in the first place? So I'll give you an example that was quite startling and very inspiring to me. So some time ago, we had a cardiologist. Not yeah, he worked as a heart surgeon for a while, but he was a cardiologist, and he came to the Prama Wellness Center, and he liked and enjoyed the program very much, and we kept in touch. And one time, I was invited to his clinic, and in the clinic, he showed me the photograph of one of his patients and the artery that was hair thin, and he was scheduled for bypass heart surgery. And then he said, I gave him another option. He said, I told him that if he followed the Dean Ornish diet, and I'll get into some of that diet in a little while. He said, if you do the Dean Ornish diet, I think you can avoid surgery. And then he said, and that is exactly what the patient did. And then he showed me the photo of the same person's artery 1 year later, and it was normal. So what we are seeing actually, when we are reversing heart disease by reversing our diet, changing our diet to become more plant-based. And I will also mention that fasting and cleansing can even speed up this process even more. But what we're seeing through not just anecdotal evidence, but through now massive scientific evidence, through the Dr. Dean Ornish's work, for example, we're seeing that it is possible to reverse heart disease. So in other words, it is not necessary to take these medications and to have surgery in many instances. Of course, if you're taking medication and you want to reduce your medication, then you need to work with your doctor to do that. And that is something we have done many times, help people changing their diet by working with their doctor.
Great, great. So yeah, I mean the Dean Ornish diet is very well known, very popular, and we know it's very effective. Maybe you could talk a little bit more about what kind of foods are in that diet, or and other types of foods that not only can help you cure or improve your condition, your heart condition, but also prevent heart disease itself.
Mm-hmm. Yeah, so basically there are um, some rules to follow, so to speak. So to start with the Dean Ornish diet, which is in some ways similar to the diet that we suggest, it's basically a plant-based diet. As I mentioned in the Chinese study, the China study, it was found that as they changed their diet from primarily vegetarian to meat-based, heart disease increased. So similarly, if you reverse, do it the other way, basically, you can reduce your chances of developing heart disease. I would say even eliminate it. Dean Ornish himself claims that he has had 99% success reversing heart
Wow.
disease. It's quite amazing. So what kind of diet? There are different types of diets, but basically the number one food should be based on plants. Um, that means that it is very important to cut down on meat or even eliminate meat and fish and eggs because they're very high in cholesterol. So we want to reduce the LDL, low density lipoprotein in our blood. And one of the best ways to do that is to eliminate or reduce meat, fish, and dairy also in our diet, and eggs. So only a few times a week if you want to continue eating those types of foods, but even better would be to eliminate it altogether. Even dairy, I would say, is one of the main causes of heart disease. So reducing dairy as well. So then a third element of good food habit is what Dr. Joel Furman calls a high nutrient dense food. And again, what is interesting is that high nutrient dense food is actually found in the plant kingdom. So what is high nutrient density? That means the more nutrient per calorie. So olive oil, for example, is not necessarily a bad food, but it's also not the greatest. 1 tablespoon of olive oil has about 120 calories, but not that much nutrient. So it's actually not very high in nutrient density. But when you take the same amount of calories of kale, for example, you will find that you get very, very high nutrient density. So in other words, shifting our diet towards these type of plants that have high nutrient density, and that's basically the salad green. So eating more salad is probably the number one best way in terms of consumption of food to prevent heart disease. Eating lots of salad, lots of greens, lots of vegetables, and then lots of fruits, which is another important part. It is sort of like my number 4 item, which is high in antioxidants. And number 3, healthy fats. And where do you get those healthy fats? Also from plants. And the best form is actually to do it before we make them into oil. So rather than eating olive oil, eating olives, rather than eating peanut oil or using that in your cooking, eat peanuts or other types of nuts that are very healthy. And avocado is again, for example, a very healthy oil
I love
for the
avocados.
heart. Yeah. So yeah. So these are some basic rules to follow. And then number 5 on my list is herbs. There are many different herbs that we can use, such as ginger is very good for the heart. Um, cardamom is good for the heart, and also hawthorn is often used by many naturopathic doctors, prescribing that instead of heart medication for people to lower blood pressure and to regulate the heartbeat and so on. So there are also a few really good herbs that people can use. But again, I'm not here to diagnose, prescribe. I'm here to just share healthy habits. So always work with your doctor when you want to change your diet or take herbal medicine, so that there are no contraindications, because that's very, very important. Some herbs are contraindicated with certain medications.
Okay, great. That was very helpful.
So,
So some people ask, do you have to be vegan to prevent heart disease? Is
yeah,
that an important thing?
yeah, right. Well, I think maybe some vegans might tell you that, you know, and vegetarians might say, oh, you have to be vegetarians, you have to be vegan. Um, I don't think you have to. You don't have to. But I think that, as I said earlier, it is very important that our diet is primarily vegan or vegetarian. And again, personally, especially now during the COVID-19 crisis, I have been 100% vegan for the last 3-4 months, even starting before the crisis. And I feel really good about that, both for health reasons and for environmental reasons. I think eating more plant-based food is also much healthier for the environment. But you don't have to be a vegan or a vegetarian. But as I said earlier, it is really important that people reduce their meat intake, eggs and fish, dramatically, because it is in those types of foods that we get the bad cholesterol, the LDL, and that is what is causing heart disease in the long run. And then, of course, as I mentioned, sugar is a cause of it too, because sugar turns to fat. The sugar that we're not using for energy, you know, you eat a lot of Snicker bars or pastries and so on, and you don't work out, then that increases the fat in your body, in your liver, and so on, and then that turns into bad cholesterol and so on and so forth. So yes, I do think that the vegan diet is preferable, or vegetarian. Yes, I do think so, but you don't have to.
Okay. Thank you very
Uh,
much.
I just one last thing I would.
No, that's it. That's it. Okay, one more thing you can.
One last thing I want to mention regarding diet. You can be a healthy and unhealthy vegan, and you can be a healthy and unhealthy vegetarian. And similarly, you can be a healthy or an unhealthy omnivore, because you can be a vegan and live on and sweets and and not be very healthy. So it's not so much particularly the diet, but rather what we're eating that is important. So plant-based food, that's the main thing.
Okay, great. So, I mean, besides food, what do you do at the Prama Wellness Center? Um, in your programs online, what do you teach um, beyond the diet? I mean, that's helpful for heart problems.
Yeah, so again, let me give you an example of how we help people. So one gentleman, had just turned 80 years old. He when he came to a 5-day program, he said that his primary goal was to lose about 20 pounds, and he wanted to reduce his cholesterol and his blood pressure. He was on medication, and he had a little bit of a pot belly stomach that he wanted to lose, and so on. So basically, during the 5-day program we have at the Wellness Center, not only do we teach people about good diet, but we also teach people how to use fasting as a way to become more healthy. So that is one very important aspect of our program. And so during a 5-day program, people fast for 3 days with juices and so on. So he did the 5-day program. He fasted for 3 days. But in my consultation with him, I suggested that he continue to fast for a few more days. And then I said, have a meeting with your doctor, tell him what we are planning to do so that he can help you reducing the medication. And that's exactly what he did. He met with his doctor. His doctor approved the program. So over the course of, I think, about 30 days or so, he fasted for about 7 days, and then he basically changed his diet to become more vegan, vegetarian. And he wrote me after that and said, you won't believe it, but I've lost my 20 pounds and I'm off medication. So here you have someone, a very typical situation, a person, he's elderly, feeling like his energy is going down. He's on medication, doing okay, but not really feeling like he's, at full peak. So he came to us and we helped him change his diet, and he lost his pounds, he's feeling lighter. And at the same time, as a bonus, he's off his medication. So our program in one way is very simple. At the same time, it is important, I think, for people to come and see people like us, or come to a retreat, or learn online, because they may not know where to start, where to begin, and also many people need support. And that's one of the things that we give people. We can support people. We can, be there, shoulder to shoulder, so to speak, through coaching or through our programs. We have some online programs. We're going to continue with these kinds of interviews, and people can sign up and buy our videos and so on online. So there are many resources. And then, of course, when the crisis lets up, they can come to our retreat center.
Great. So I know also you integrate sometimes yoga meditation into your programs. How are these important for healthy heart?
Yeah, very good point. So Andrew Weil, who is very well known in the health field as I call him Mr. Holistic, Dr. Holistic. He's has a lot of good commentaries, writings, and so on. One of the things he says is that there are two main reasons for uh, lack of health. One is stress, and the other one is a bad diet. And at the Prama Wellness Center, we work on both those two issues. So there's nothing better, I think, to reduce stress than to practice yoga and meditation. And I think that is one of the reasons why our programs are popular, because people practice meditation in the morning, in the afternoon. We do long sessions of yoga, and so people can feel a deep sense of relaxation and so on. So yes, I see that the people that become most successful in reversing heart disease, they are the ones that also incorporate some form of meditation and yoga into their lifestyle. It's very important. Just practicing certain techniques, simple techniques that we are teaching, can really be life-saving for people.
Okay. Anything else as we conclude here our first Prama talk?
Well, it's been nice to see you and meet you online, so to speak. You had some really nice questions. I guess, to conclude, maybe I try to sum up a couple of points that people should eat a primarily plant-based diet, nutrient-dense foods, lots of greens, use herbs like ginger, turmeric is also a very good anti-inflammatory, and so on in the food. Drink lots of water, practice yoga and meditation. And finally, if you want to learn about our whole package, then come and visit us either online or at one of our retreats.
Great. Well, thank you very much, Ramesh, for that
All
information
right.
about alternative ways of handling heart problems. And I know that this month, for our next I think 3 or 4 weeks, we'll be having you back again to talk about other aspects of health, of living a healthy life, a healthy lifestyle. So we
All
just want
right.
to invite everyone
Very
back
good.
here. You want to say something? No.
Okay.
We want to invite everyone back next week, same time, and Ramesh will join us again for another topic on wellness and health. Okay, well,
All
thank
right.
you very much. Thank you, Ramesh,
Thank you.
for joining us, and hope to see everyone next week. Take care and keep safe.